Okay, we are going to start session 10 just a little bit early since we are moving session 3 from yesterday right directly behind that. So our next presentation will be removing barriers to immunization with limited staffing, presented by Ms. Kelsie Stafford and by Ms. Grace Tracy. So Kelsie Stafford started her public health career in 2014 as an office manager at the Cass County Health Department. In 2021, she became the clinic manager as Cass County Health Department. Her current role includes the following: ordering of vaccine supplies, managing vaccine clinics and drive-thru events, managing healthcare-related grants, and overseeing the vaccine billing for the clinic. Kelsie prides herself on the relationships she has worked so hard to build with her community and schools. Her team is a true testament of hard work and dedication for an entire community. She is very proud of all the accomplishments from over the years. Ms. Grace Tracy started her public health career in 2020. Prior to working at Cass County Health Department, Grace worked at the University of Kansas Hospital in the medical oncology unit for 3 years. Her favorite part of being a nurse at the health department is serving the community that she grew up in and where she is raising her family. Let's welcome them to the stage.
Hello, my name is Kelsie Stafford. I'm the clinic manager, and this is Grace Kress. She's the lead nurse for the Cass County Health Department. Grace and I work hand in hand on all outreach and on-site immunization clinics for our public health department. As you may know, vaccines are critical in protecting vulnerable populations. Today, we are presenting about a program we developed to remove the barriers to immunizations with limited staffing. So in 2015, we implemented a new program with just a single public health nurse and 1 clerical staff member. That changed the immunization game for our county as a whole. Our goal was to decrease the risk of vaccine-preventable disease infection by cultivating relationships, providing vaccine access, and building vaccine confidence in school-aged children and their families and school administrations. Our program focuses on school-based clinics, but our hope is that we can take the information provided here and implement changes to remove barriers in our community health department or your organization. This project was created by a public health nurse named Dina Clark. If any of you have ever had the pleasure of meeting her, you know she has great passion for educating her community and using public health to its maximum value. She is always looking for new ways to build new relationships outside her organization and provide excellent service in a timely manner and with minimal hurdles for everyone involved. So let's start with the background on Cass County, Missouri. Our health department is located in the county seat of Harrisonville, Missouri. It's located directly south of Jackson County and is part of the Kansas City metro area. Our last population census was just under 110,000. So as you can see from our slide, that our county has been growing at a steady rate for decades. And of that population, 23.2% are persons under the age of 18. With a large portion of our client base being children, we wanted to start a program that addressed this section of the population. Our county spans 702 square miles, and the northern half of our county is suburban, setting at the very edge of Kansas City Metro, whereas the southern half is very rural and has limited access to primary care providers, hospitals, and even our health department. We have 10 school districts in our county, and they all are very, very different. They range from 118 students in one school to some schools have near 6,400 students. 5 of our districts are located in the southern half of our county with limited access to resources. Due to the disparities between northern and southern areas of our county, we continuously need to adapt programs for each of our district's needs. Our health department, like many others, has faced challenges with limited resources and staffing. Prior to 2015, our health department only had 2 part-time nurses. They only worked less than 15 hours a week, and they were there at the exact same time. That only left our health department giving very few time slots for immunization appointments. So with that being said, we in 2015 made a huge change in our health department and hired one full-time RN after the retirement of our two part-time RNs. So with that being said, we worked tirelessly to try to find out how we could change the vaccination game for our county. Again, that full-time RN was Dina Clark. She wanted to find a program that would help our county and our community and figure out where we could meet the needs of that community. So our first step towards aside from a small staff, we only had 11 full-time employees, which 4 of them were WIC employees. So that was 1 full-time RN and the rest were health department employees besides 4 WIC. Aside from the small staff, we also struggled with visibility. Many people in our community were not even aware of the county's health department, let alone the services we offered. So with that, and then once we decided, we asked people about our health department, they all assumed if they did know us, that they assumed that we were only for the poor. Unfortunately, public health is for all. So why this project? We knew we needed to improve access to our immunization services and remove the barriers for our community. We were looking to build relationships that would be beneficial for years to come. Since almost a quarter of Cass County's population is adolescents, we decided to focus on our program of school-aged children. At that time, the number of students current with their required school immunizations was unknown to us, so we had to reach out to our school districts to identify how we could address students' needs for school-required immunizations. We discovered many students were out of compliance, especially in the rural parts of our community. At this point, Dina proposed taking our vaccines on the road, something we had never done before. So this was the perfect way for us to accommodate the school's need to fulfill our department's mission of providing public health for all. We offered each school district an on-site clinic to remove barriers preventing students and families from getting access to the required school immunizations by conveniently bringing them to them. This addressed the most common barrier to childhood immunizations for children. We have a lack of availability of providers in our area. Transportation may become an issue for some, and the economic and academic challenges for students and parents taking time away from school and work just to get those immunizations. So let's go back in time just to keep you guys interested. We're going to give you a little comparison about what we were like with just 2 part-time nurses versus our first year of running some of these clinics. So from March 1st to April 30th of 2014, with our 2 part-time nurses, we only administered 41 vaccinations total in our office. That shows you how limited we were on offering vaccinations to each person. So we're going to fast forward to 2015. After launching our new program of this school clinic from March 1st to April 30th of 2015, just in 3 of our base school clinics, we administered 301 vaccines and saw 260 students. The implementation of our school immunization program yielded a 634% increase in 1 year. So yeah, since we saw the 260 students immunized in that 2-month period, it doesn't seem like a whole lot, but that's 260 students that didn't have to be absent from school to receive those immunizations. That's 260 parents who didn't have to leave work to get their child immunized. As a parent myself, I can be very understanding of that. That's also 260 students that lost less than 10 minutes of class time for a required school vaccine. In just 1 year implementing this program, we saw a significant increase in vaccine administration. Seems small, but 260 students, when you think about all those points that I just mentioned, is very valuable to Cass County residents and to have those opportunities. Our most successful program year was in 2016 with 786 vaccines administered in the same 2-month period in our school clinics. So before we dig into this logistics side of things, I just want to remind everybody, we were a small health department. We did not think that this would be successful for us and this feat would be too much. We have learned very different things now. This is one of our favorite things to do every year. Our school nurses actually reach out to us before it even starts saying, oh, I haven't heard from you about your school clinics. Can somebody please sign me up? Be like, oh, you're ahead of the game. Nobody's even scheduled those yet. But just know this is our logistics and things, a way of doing things. What may be best for you guys may be different. We're just giving you an idea of how we started. So let's dig into the logistics. First off, we knew this feat would bring many challenges and changes to our way of doing business, so we needed a game plan. We looked at the schools and asked each about the number of students that were behind or missing required immunizations. After receiving those numbers, we quickly realized that there was a need for our services in a tangible way that could help our community. So Dina and I was also the person that was there, Dina and I thought long and hard about the best plan of action to bridge access to meet those high non-compliance vaccination rates within the schools. Using our prior preparedness training made this a lot less difficult and a lot less stressful. The mass vaccination drills and exercises that the health department participates in on a regular basis helped us understand what resources were needed and how we needed to plan for this project. So use your day-to-day activity if you're in public health to help you take on this type of project. In preparation for offering our services at the schools, we got in contact with all of our school nurses and asked if they saw a value in offering a vaccination service within school hours and on-site for their students. We asked if they'd be willing to partner with us on this endeavor and gauge how parents or guardians may perceive this idea. Most of all, school nurses jumped at the opportunity to help their students and families get back on track with immunizations, because we all know school nurses are very overworked. So we put together packets explaining who we were, our preparation and implementation plan, and information about which age groups that we were going to be targeting, what vaccines would be offered, and the benefits to their community. We also wanted to be cognizant of and address any concerns parents may have about immunizations being administered without them being present. The packet and program information were well received and helped the school districts have a better understanding for what we had to offer. In the beginning, we focused on just 7th and 8th graders. We wanted to start small. So we later expanded to 11th and 12th graders when MCV became required for this age group. And later we added meningitis B to our list of offered vaccines. The next barrier we would face, HPV. Let's be honest, we all know the stigma behind it. We already knew we would be offering Tdap, meningitis, and Min B later. We were faced with a dilemma. Some schools did not agree with our decision to offer the HPV vaccine. It was difficult, but we were firm with our mission to help prevent all vaccine-preventable diseases. And if we could not offer all recommended vaccines, we would not bring that service to their school. So, later we just provided education about the HPV vaccine and addressed some of their concerns to superintendents, even spoke to some school boards. That was a tougher battle. After some long discussions, we had the majority of our school districts ready to partner with us. Only 2 of our school districts out of the 10 decided not to participate and only passed because they had such a small amount of students that they did not have the high non-compliance rates that everyone else did, and they didn't feel that the work that we would put in and they would have to put in would make for a good clinic. So it had nothing to do that we required HPV to be on the list of offered vaccines. So we had to identify how many students we would be vaccinating and what vaccinations they may need. We created just a physical paper form for school nurses to send home with their kids or email it to their parents depending on their preference, along with vaccine information statements so family could read all the necessary information before deciding to sign their child up. At the bottom of our forms, we put checkmark boxes for all vaccines that were offered and what age groups were recommended to have each one. We required parents or the school nurse we required the parents to return these to the school nurse and within 48 hours of our clinic so we could determine what vaccines may be needed, look up their records, and coordinate with the school nurse to confirm the immunizations that may be required if we didn't have a record on file. If the school nurse discovered the student was behind or out of compliance on another vaccine, such as Hep B, we would reach out to that family at that time and offer that vaccine to them. We weren't just there for specialized vaccines. If they needed anything, we were willing to help them out at the time. So if we discovered that a parent turned in a form and said that their child needed it, but we had a record, we would just call them and be like, listen, we really appreciate you signing up, but your child's already had their recommended doses. They're not going to be seen at this clinic at school. Parents were very thankful, understanding, and everything worked out wonderfully. So the health department's preparation. After receiving all the students' forms, Dina would write what vaccine was requested, and after one final review, she would highlight and initial what she was going to be giving that day at the on-site clinic and would be clear and concise for administration of her vaccines. After the nurse's review, she would hand over submissions to her clerical partner, which was me, and I would alphabetize them, review the insurance information, write on each form which funding source of vaccine would be administered, and this would also be placed at the top of the page and be initialed so she knew that we had both looked at it. Our spreadsheet would then be made, entering all students' information, including their names, dates of birth, requested vaccine, their funding source, of the vaccines administered, and their emergency contact information just in case something happened to go wrong while we were seeing that student. A different spreadsheet was then shared with the school nurse, providing her the information of which students would be participating, allowing the schools to decide how they wanted to limit the students' time away from class, whether it be calling down 5 or 10 students at a time, or if it was a small clinic, they could call them all down at one time. So the day the clinic preparation was made easy due to the spreadsheets and telling us how many vaccines needed to be packed, what source we were using, the additional needs, and everything like that. So we arrive at the school. Once we arrived at school, we would meet the school nurse, get set up in the room that they provided us. Upon student arrival from class, the clerical staff member would then line them up in the hallway, check them in on her spreadsheet, hand each student their consent form back so they could take that into the nurse and hand that to her at their time of vaccination. Once they handed over their form, she does her normal, can you give me your name, your date of birth, things like that. So each student would hand the nurse their consent form when it was their turn. She would draw the vaccine, administer, sign her paperwork for proof of what she administered and location, and answer any questions that student may have, and then send the child straight back to class. On-site clinics concluded, and we just returned to the health department. The nurse and clerical staff would then conduct inventory prior to placing the vaccines back in the units, auditing the forms and the spreadsheet for checks and balances. Once inventory was confirmed and supplies were put away, we would enter all the vaccines given the same day into Show Me Vax. Some of you may have an EMR or EHR system, which populates into Show Me Vax for you, but at this time, we did not have that capability. After data entry, a report was run to confirm all entries were free of errors and that Show Me Vax was complete. The spreadsheet of participants was then sent to the school nurse for her record, because of course everyone on our original spreadsheet, some students may have been absent, so we wanted to give her an updated list. If the patient received a vaccine that was part of a series, that would then be noted and given to our clerical staff for the health department to reach out and try to schedule the next dose to complete the series. We never wanted anything to go missed. Over the years, things have evolved for us. We now have an EMR system, and the nurse signs and completes all notes and records before even leaving our on-site clinics to this day. Reports are still run with our EMR and Show Me Vax to make sure there's no errors, but we no longer use paper forms for our participants. We request schools send a digital link for signups now instead of paper. That digital platform that we use is JotForm. Some of you may have heard of it, some of you may not. I will say, I forgot to mention this. Back in the day, we had private insurance, but we used VaxCare. How many of you guys in this room are familiar with VaxCare? How many of you still use VaxCare? So we used to also, it worked for us at the time. We now have a medical biller and have all of our own private contracts. But back in the day, we understand, we've been in your shoes. We know where you guys sit. So reports are still the spring clinics. So these were spring clinics, and they have opened the door to more clinics and clinic opportunities. Our school districts began inviting us to their yearly fall enrollment events. We now have 5 school districts participating in fall events. With the help of our school districts and their advertising efforts, our most successful clinics are actually held at our office. They're walk-in only clinics, and we host them at our health department for 4 weeks, starting at the last week of July and running through August. These clinics are no appointment necessary, and the patients leave with all proper documentation for their vaccines. Because as we all know, when it gets close to school time, every school nurse is sending out notifications about what each child needs. There are no doctor's appointments slots left open during that time. Health departments are looked upon greatly for that. So we open up as walk-in and take care of those students. So we've used clinics as drills and exercises for points of dispensing or pods. Anybody in the health department world would understand that. For example, we used a school clinic of over 100 participants to evaluate our process and discover from the minute they were called down to the clinic and returning back to class that students lost less than 15 minutes of class time. I don't know of any doctor's office that you can visit and attend, check in, be vaccinated, and return to school in 15 minutes. This discovery reinforced the importance of how this project helped remove those barriers for immunizations. The relationships built from our school clinics were also a core factor in engaging and communicating with our community during COVID-19. These schools already knew who we were. We had already built levels of trust and respect with them. They knew that we had a common goal, and it was to keep our kids safe. So in the midst of chaos of the pandemic, we were also able to facilitate a smooth introduction to our COVID-19 team of disease investigators and epidemiologists. So let's just go over it one more time. How did we remove those barriers with limited staffing? We got information out about our health departments and giving access to vaccination services offsite. We provided a location in which the patient was already going to be. We provided access to vaccinations with minimal time from class and limited absence from school. We provided for parents limited time away from work. And being a name that we can refer to and trust for our services for maybe their children that aren't school age but could still come to our health department for other services. Now I'm going to turn this over to Grace and have her read a few of our testimonials from our school nurses about what programs the health department means to our school.
Hello, everyone. The first testimonial is from a K-12 school nurse where K-12 goes all in one school. Drexel is very thankful to have a working partnership with the Cass County Health Department. They were all a blessing to have at our side during the height of the COVID-19 pandemic. They were always available and extremely helpful in navigating through such uncertain, difficult times. I have been extremely grateful to have their assistants come to our school for immunization clinics throughout the years and to have such flexibility in getting our students up to date on their immunizations. I have also been thankful to have the health department to call as needed when I'm uncertain what to do in situations. Thank you for all you do for our school and community. Our next testimonial is also from a K-12 school. It's the district nurse. And she says, our school has worked closely with the Cass County Health Department for the past several years. The staff is friendly and knowledgeable. They are an incredible resource for us regarding questions on reportable diseases, pandemic information, as well as obtaining Narcan for emergency use here at the school. They also provide an immunization clinic that is open to incoming 8th graders and 12th grade students to receive the mandated state vaccines every spring. They have everything organized and are quick and efficient with this project. The Cass County Health Department offers flexible hours during the months of July and August to vaccinate many of their students in the county prior to school starting. I always recommend our parents to take their students to the local health department for any needed immunizations. And then these are kind words shared by the Belton School District. And Belton is a larger school. They have multiple schools for different grades. The Belton School District is very fortunate to have a strong partnership with the Cass County Health Department. Belton school families benefit from convenient on-site vaccination clinics hosted by CCHD at enrollment and during the school year. Epidemiologists offer guidance on infectious disease prevention and potential outbreaks in the school setting. During the COVID-19 pandemic, CCHD provided on-call support and coordinated weekly meetings with school district nurses across the county. Over the years, the health educator has been a reliable resource in participating in district parent advisory and health service meetings. The relationship with CCHD is vital to the ongoing health and safety of our school district community. And then we have final words from the co-creator of this program, Ms. Dina Clark. She says, "It was my pleasure when asked to provide a note on what inspired me to create the school immunization program for our health department. Like many of you, my career has been spent in a community-based setting And when working in this field, we're often developing strategies based on the question, what is a deterror in our community from the outcome we are looking to improve? The answer is often time and money. How could I help parents from having to take time off work, children having to miss school, and doctors' offices from being inundated with appointments for vaccinations at the end of every summer? The solution met the challenge where it's at. With a well laid out plan, support from our schools and community, our team of 2 to 3 built a program that increased the health department revenue and immunization rates and decreased the burden of time and money in our community and its partners. I thank you for inviting us to share our experience and invite you to contact us if you have any questions. That's nice, Dina. Quoting Peter Block, we are a community of possibilities, not a community of problems. I am so proud to have been part of this exceptional group of people who believe just that.
So why we're up here today is because we were scared to start this program also. We want everybody out here to know that we had to learn from other people also to even know about this program. Please reach out to any other partners or community members or even a health department to help you start these programs. I promise you they are very beneficial and will build relationships for years to come that will be important for all of you. So at this time, we would like to take any questions you guys may have.
We are coming around with the mics.
There you go.
Hi, my name is Tabitha. Not really a question, but I'm from Nottoway County, so a very rural, small county in Northwest Missouri. We have been running the same program for the past 15 years now, and I just want to say that those of you that are thinking about this is an awesome program. Couple of things. One of the benefits to it that we found is that kids do so much better when they're not with their parents. So that's one of the best benefits that I've found, that they are not acting up in front of their friends. Even though they're getting their vaccination by themselves, they're totally different. The other thing, I don't know if you guys have done this, but the past probably 3 years now, we've started with 6th graders too, because that's actually the age that they should be getting those vaccines. So that may be something to implement as well.
We have talked to our school nurses about the 6th graders. The majority of our schools that would have enough to be able to participate, those students go to a different school. So it's the job of the district nurse to be able to allow us to go into a school. And also the district nurses have showed a little bit of hesitancy. The younger we get, before parents not being there, we're still trying. We obviously stopped these clinics during the COVID pandemic because we had other things to do. So getting back into these, we're rebuilding those relationships again and trying to get that, but that is a great idea. We would love to offer those to our 6th graders.
Yeah, it's really great. I mean, it really works well with them. We have not had any issues with that age group either. Couple of other things that we've noticed with our programs is this also builds things. We do the same thing in the fall. We go back to their registration day to get a lot of those other kids that still didn't maybe sign up.
We do too.
And then we have also opened the door to flu clinics. So we run flu clinics at their parent-teacher conferences, which also opens the doors to the parents and the other kids that may not be school age. So some other things to think about there.
That's a great idea. Thank you for us and for everyone else sitting here in the audience. I appreciate you.
What county were you from?
Nottoway.
Nottoway County. So questions on how this program works? Nottoway County is here. Cass County is here. I love learning from each other. This is what this is all about. Other questions from the audience for our 2 great speakers? I see one hand coming up.
Hi, we were back here rooting for you. I don't know if you saw us. Love all of this, and Nottoway, you too. And I know Taney County, they do a lot of back to school stuff and all of that. So I just am always impressed with the hard work you do at LPHAs because you're wearing multiple hats. So my question was, when we visit clinics, they're hesitant to put HPV on the same consent form that goes to the parents because they feel like they would just deny all of them. How did you put that on your consent? Were they just listed in a row? I know you said there was a checkbox for all, so everything was listed?
Yeah, they were all listed.
Mm-hmm.
The HPV, meningitis, and Tdap were all listed. It didn't say required. It didn't say recommended. It was just on there for them to pick.
Are those forms that you use some of the other documents linked with your QR code?
Yeah,
for
so
folks?
in the QR code is our contact information along with the packet that Dina created that has that what she gave as a template. And it has, at the time we were using VaxCare, and it had that VaxCare form, and you can see where it was listed. I think I put in one of the old paper forms that we use that shows where the vaccines are listed as well.
Okay, excellent. Great contact information for bringing this to new and more communities across Missouri. Other questions from the audience? Going once, going twice. All right, with that, let's give our presenters another round of applause.